Role modeling is a form of education that you can see quite often in the nursing field. Role modeling is an instructional method that you can see both in nursing school as well as on the job training. Nurse educators and preceptors provide guidance and support to new nurses as well as student nurses as they continue their journey to become a nurse. As stated earlier, role modeling is the observation of behaviors, interactions, and patient care. We combine the social learning theory and stages of development in order to promote positive behavior or positive behavior changes, as might be seen in a nurse that's learning a new care practice. You can see role modeling between nurse educators and their students, and you can also see nurse role modeling on the unit with preceptors and their mentors and an orientee or a new nurse. Role modeling can fall into all three domains of learning. The first domain, the cognitive domain or our thinking domain, can be seen and it initiates the understanding and the thinking process. So for example, if a nursing student watches a nurse expert video in relation to a simulation scenario prior to completing the simulation scenario on their own, this allows the student nurse to see what an expert nurse would do in that situation and how they would proceed. Student nurse can then continue with the cognitive thinking. So as they go into the scenario, they're already thinking ahead, this is what I'm going to do. Role modeling can also fall into the affective domain or the feeling domain. This involves the expression of emotions, beliefs, and values. This also allows for the preceptor, the nurse educator to role model social development and allow for a successful integration of the new nurse into the nursing unit itself. The final domain that can be seen with role modeling is the psychomotor or the skills domain. This is our hands-on skills. So for an example, the nursing student actually completing this simulation scenario in the skills lab would be an example of the psychomotor domain. Just as with all the different educational models, role modeling shares both positive and non-positive effects. The positive effects of role modeling is that it provides a solid support point for new nurses as well as nursing students. They should be able to, on the unit, go to their nurse educator, go to their preceptor, express concerns, ask questions, share how they're feeling. It also allows for positive and real-time solutions. If a undesired behavior happens on a unit, the nurse educator can educate the student as to why that behavior was not appropriate and how it could better be presented next time. It also allows for nurses who have experience on the units and with education to share their experiences and their knowledge with nursing students and new nurses. So while role modeling does have many positive aspects, there are also negative aspects to it as well. It can be difficult to find and train both nurse educators and preceptors. It can also be a challenge if a nurse educator or a preceptor is exhibiting undesired behaviors, then those behaviors can be learned by new nurses and student nurses. And so then instead of teaching them good behaviors, they're being taught undesired behaviors. And that could be a challenge to correct once they're out on the unit. The other con to this is you need to have a strong rapport between both your educator and student, as well as your preceptor and orientee for success. If there's not a good rapport or there is a challenge in the communication barrier, then the orientee or the student nurse may not learn the behaviors they need to be successful. Some role modeling examples that you'll see in everyday scenario between the nursing student and the nurse educator during a clinical situation when a student is passing medications with their clinical educator. The educator role models this to the student what needs to be completed, and then the student mimics those behaviors as they do it and give the patient their medications. You can also see this on a regular unit between a nurse preceptor and a new nurse. A new nurse being taught how to complete a fall assessment on a patient on the unit, the nurse preceptor is acting as a role model. A final example that we see is between ourselves as nurses and our patients. As a nurse educating a patient how to take their blood glucose level if they had not known how to do that prior, I role model to them the behaviors of how to properly complete the task, and then I have them complete the task. Role modeling can provide many opportunities and teach and change many different behaviors. Um, Following is a clip about why being a role model and being a mentor is such an important aspect of nursing. I hope you enjoy.